Since 2010, September has been designated Blood Cancer Awareness Month. It brings hope, love, and a cure within focus by elevating the public conversation about blood cancers. We're contributing to that today, joined by Janet Jordan and her physician, Dr. Joshua Brody. Good morning.
Good morning.
Good morning.
Janet, take us back 10 years, if you would, to your diagnosis and tell us, how are you today?
Yes, 10 years ago I had a normal appointment with my endocrinologist for a routine appointment, and she found a lump in my neck. And she then referred me to another doctor who took tests, etc. And then over the next years I received 2 types of chemotherapy. But currently, the last 3 years, I have been receiving what is known as a targeted therapy, and my lymphoma has been in remission for 3 years, and I'm living a normal life.
That's wonderful. As you were going through those treatments, how did they affect your day-to-day?
Initially, my day-to-day remained normal because I didn't receive treatment right away. But later on, I began one of 2 chemotherapies, which left me a little bit depleted energy-wise, but I was still functioning, still working. But after that, when I had a recurrence, I had a large chemotherapy that did caused me to go on disability and basically just have treatment and go home and rest.
Janet, for you it was a regular,
so
a routine visit. I'm sorry to interrupt there. Dr. Brody, I'm wondering for our viewers if you would mind to explain some of the symptoms and signs associated with blood cancers. Not everybody's going to discover the way Janet did through that routine visit.
Sure, absolutely. So blood cancers are extremely common in America. Most commonly, we divide them into lymphomas and leukemias. These are both cancers of blood cells. Lymphomas are cancers of lymphocytes, so they spend most of their time in lymph nodes, either our lymph nodes in our neck, under our arms, or in the tops of the legs. And those lymph nodes can become enlarged, and that's actually the most common presenting symptom of low-grade lymphomas, like which Janice has. Low-grade lymphomas, there's good news and bad news. Patients can live for many years, for more than 10 years, more than 15 years. That's the good news. The bad news is that we don't have a cure for low-grade lymphomas like follicular lymphoma here in 2015. But I say it that way because our intention is to have a cure in 2016 or 2017. Wow. And the amount of progress we've made over the past few years pushes us towards that. So
what do you attribute that promise to? Are you working on treatments or research now?
Sure, absolutely. We are, both as a research community throughout the world and at our institution at Mount Sinai School of Medicine. We're very actively working on new therapies, especially for, in my case, patients with follicular lymphoma like Janet has. Some of the most promising types of new therapies, in addition to the standard therapies, which include antibody therapy and chemotherapy and radiotherapy. There are some newer therapies. Janet mentioned this targeted therapy, which she's been receiving, which is just a pill that patients take every day, like their blood pressure pill or their cholesterol pill. And as Janet mentioned, she's been in complete remission for 3 years now with, as she said, very few side effects. So that's been a huge change in the treatment of low-grade lymphomas like follicular lymphoma. And another type of new therapy that we're developing is something called immunotherapy, in which we actually push patients' immune systems to recognize their own cancers and to attack and eliminate them. And that's been an idea for many years, but just over the past few years, in many types of cancer, we've seen awesome results with giant tumors melting away as we get our patients' immune systems to recognize and eliminate them.
It's just incredible. Is there a website with more information about some of what you've talked? I think if our viewers are interested in kind of continuing the conversation, where would you send them online?
Yes, there are 2 excellent websites, the lymphoma.org and also the Leukemia and Lymphoma Society website, lls.org.
We have an awesome chapter here in our area. Janet, continued good health to you, and Dr. Brody, thank you for joining us. We appreciate it.
Thank you.
Thanks, Mary.
Thank you. Still ahead, fashion statements inspired by the world of wine. We'll head to New York City, where Fashion Week is underway. But first, an invention from local business owner Thor Schrock. Here it is. There will explain how it works and what's happening right now to bring this device to the market.